Welcome to the Audit Spotlight, where we break down key reports from the Office of Inspector General. Our goal is to make government oversight more transparent, one episode at a time. In this episode, we turn our attention to a sobering and urgent topic: the continuing failure of the Medicare system to provide adequate treatment for opioid use disorder, also known as OUD. Despite decades of escalating concern over opioid addiction, overdose deaths, and the rise of synthetic opioids like fentanyl, Medicare's efforts to ensure access to life-saving medications for OUD remain tragically insufficient. According to the Department of Health and Human Services Office of Inspector General's April 9, 2025 report, fewer than 1 in 5 Medicare enrollees with a diagnosed opioid use disorder received medication to treat it in 2023. This finding comes despite federal efforts to improve access, including the 2022 removal of the so-called X waiver, a special DEA requirement for prescribing buprenorphine, a critical medication used to manage OUD. Let's first break down what these medications are and why they're so vital. Buprenorphine is a partial opioid agonist. In simple terms, this means that while it does bind to the same receptors in the brain as opioids like heroin, morphine, or oxycodone, it does so more weakly. This allows it to relieve cravings and withdrawal symptoms without delivering the intense high or respiratory depression seen with stronger opioids. Because of this, buprenorphine is widely used as part of medication-assisted treatment, or MAT, for opioid addiction. One of buprenorphine's most important features is its ceiling effect. Unlike other opioids, increasing the dose of buprenorphine doesn't produce increasingly strong effects. This makes it far less likely to be misused, and honestly, it significantly reduces the risk of overdose. Additionally, it can be prescribed in outpatient settings, even by primary care providers, which makes it so much easier to integrate into communities with limited access to specialty addiction care. When paired with naloxone, another powerful medication, buprenorphine becomes even safer. Naloxone is an opioid antagonist. It binds to the same receptors as opioids but does not activate them. Instead, it blocks other opioids from attaching to those receptors and can rapidly reverse an overdose. In fact, naloxone is often referred to as a rescue drug. Administered via nasal spray or injection, it can restore breathing in just a few minutes, potentially saving a life. In combination products like Suboxone, naloxone is included with buprenorphine to discourage misuse. If the medication is taken as prescribed under the tongue or as a film placed in the cheek, the naloxone has little to no effect. However, if someone attempts to dissolve and inject the combination drug to get high, the naloxone kicks in and blocks the euphoric effect. Honestly, this built-in deterrent is a key factor in reducing the risk of abuse. Together, buprenorphine and naloxone form the backbone of modern medication-assisted treatment. Studies have shown that medication-assisted treatment can reduce opioid-related mortality by over 50%. It can stabilize individuals, reduce illegal drug use, improve social functioning, and lower the risk of infectious disease transmission. And yet, despite all of these proven benefits, access remains limited, especially within the Medicare system. According to the OIG report, although more Medicare providers prescribed buprenorphine in 2023 compared to 2022, the number of patients actually receiving treatment remains woefully low. Out of all Medicare beneficiaries diagnosed with opioid use disorder, less than 20% were treated with any form of medication-assisted treatment. This means that the vast majority of people who could benefit from treatment are simply not receiving it. The report also highlights major geographic disparities. States like Florida, Texas, and Nevada had some of the lowest rates of buprenorphine treatment. In these states, systemic barriers may be preventing providers from offering medication-assisted treatment, whether due to stigma, lack of training, or local policy limitations. Meanwhile, access to naloxone, the life-saving overdose reversal drug, is kind of a mixed story. On the one hand, more than 750,000 Medicare enrollees received naloxone prescriptions in 2023. That's a record high and, honestly, an encouraging sign. On the other hand, the report raises new concerns about affordability and access in the near future. Here's why. The most commonly dispensed form of naloxone, a nasal spray called Narcan, is now available over the counter. While that might sound like a win, it actually has a serious downside. Once a drug is sold over the counter, Medicare Part D, the prescription drug benefit, no longer covers it. That means enrollees must now pay the full retail price. For low-income seniors or individuals on fixed incomes, this could make naloxone just, well, unaffordable. Some may choose to forego refilling a prescription that could save their life or the life of a loved one. This unintended consequence really highlights the complexities of drug pricing and insurance coverage in America's healthcare system. The OIG report concludes by urging the Centers for Medicare and Medicaid Services, or CMS, to take more aggressive steps. Among the recommendations, improving outreach to healthcare providers, removing systemic barriers to prescribing MAT, and monitoring state-level disparities more closely. The message is clear. Access to medication-assisted treatment for opioid use disorder is not just a policy issue. It's a matter of life and death. Let's zoom out for a moment and consider the broader implications. Medicare serves over 60 million Americans, including seniors, people with disabilities, and those with end-stage renal disease. As such, it plays a massive role in shaping healthcare access nationwide. If Medicare fails to adequately support OUD treatment, it sends a troubling signal to other healthcare systems, insurers, and policymakers. It tells providers that treating addiction is optional. It tells patients that their suffering is not a priority. And it tells families that preventable deaths are an acceptable cost of bureaucratic inertia. But it doesn't have to be this way. The tools to combat the opioid epidemic are already in our hands. Medications like buprenorphine and naloxone are not experimental. They are not controversial in the medical community. They are the gold standard of care, endorsed by organizations like the World Health Organization, the National Institutes of Health, and the American Society of Addiction Medicine. What is needed now is, honestly, the will to act. We need to educate more providers, fund outreach programs, correct gaps in coverage, and remove stigma from treatment. It's also crucial to recognize that addiction is a chronic medical condition, not a moral failing. The OIG report ends with a sober reminder that progress requires vigilance. Even small changes in policy can have far-reaching effects, both positive and negative. Making naloxone more available over the counter is a great example. The intent was good, but without ensuring coverage, the result could leave some people behind. To address this, CMS must think beyond coverage rules and develop a comprehensive strategy. This includes public education, pricing negotiations, and collaboration with state and local health agencies. The Medicare population is aging. Many enrollees are managing multiple chronic conditions. Some live in rural areas where addiction treatment is scarce. Others may be ashamed to ask for help. A one-size-fits-all approach will not work. Instead, the system must meet people where they are, both geographically and emotionally. That means supporting telehealth options, culturally competent care, and family-based recovery programs. It means involving pharmacists, social workers, and peer counselors in the treatment process. And it means viewing addiction through the lens of public health, not criminal justice. Thank you for joining us on this episode of the Audit Spotlight. If you want to read the full OIG report yourself, you can find it on the official website of the Office of Inspector General for the U.S. Department of Health and Human Services. The report is titled, "Fewer than 1 in 5 Medicare enrollees received medication to treat their opioid use disorder," published April 9, 2025. Until next time, stay informed, stay engaged, and as always, keep your spotlight on accountability.